Thank you, Anna Maria, for the nice introduction, and thank you for having me today. So we've heard wonderful talks about innovative ways to address UTIs and dengue analysis. And now I want to take you a little bit into a different realm, which is the one of a rapid responder, so to speak, and how we can use Oxford Nanopore Technologies in the field for outbreak investigation, surveillance, and pathogen X preparedness within a mobile Suitcase lab setup. Yeah, no conflicts of interest here. And I like to start it a little bit German and to mention our good friend Goethe, a famous German writer, who said something like, "We only see what we know," which is very true in many ways. You know, we're naturally biased to what we know and what we're expecting. But the MinION technology, of course, has allowed us to even see what we don't know or what we are not expecting. Right? And this opens up a lot of possibilities also in the terms of infectious disease detection and outbreak investigation. And so if you think about infectious diseases, there's some sort of a pyramid here. So we have different layers, different levels to it. So we have elimination drives, we have NTDs, we have ongoing emerging epidemics like influenza, which is very, very important. And then at the top, you might have something like agent X or pathogen X, so basically the unknown pathogen that will arrive at some point sooner or later. So ideally, you want to develop a framework that allows you to address all of these layers in an integrated way. And also taking One Health into context, so being able to test human, animal, and environmental samples to bring it all together. Now, there is, of course, different approaches to infectious disease surveillance. For this pyramid, let's say, so we have classical surveillance systems, we have active outbreak investigations, we have early warning systems that all together kind of try to give you knowledge and expertise towards this pathogen X preparedness, right? But this in the field, of course, is quite difficult to get. So you need something that's rapidly deployable, that gives you the answer that you're looking for in a relatively simple way, right? Because you usually have to go to resource-limited settings where you don't have the biggest machines. And so, you know, we've heard some neurological talks and posters as well. In neurology, there's this saying that time is brain, right? So the earlier you detect brain damage, the better is the outcome for the patient. And here you could say something like, time is public health, right? So rapid response is essential to mitigate the effects of it, right? And so in this case, it's very useful to take the lab to the sample and not the sample to the lab, right? And here's where the rapid response mobile labs come into action. So there's different types of them according to the size of the modules or in the scalability. Our lab is a little bit a smaller one, so it's a type 2, meaning it's box-based. There's different modules that we use. So here on the left side, you have the glove box, which is basically a closed container to do your sample preparation and inactivation, which is really important. We try to use DNA extraction methods that are, let's say, quite simple, because you cannot take all of the stuff that you have in your lab. So we mainly use a method that's called reverse purification. And then this inactivated and extracted sample goes into the mobile Suitcase lab that you can see here in the middle. It's fully equipped to do molecular diagnostics in the field, basic ones. You can update it and adapt it to whatever you want to do. And we use, of course, also Nanopore Technologies. Here you can see the MK1C. We've used MK1B as well, and now we're also switching to MK1D. So this is quite unique to Nanopore, that we have those small devices that fit in the backpack when you're traveling. Yeah, it's something that we use very eagerly. And then, of course, the data analysis part, which is a tricky one as well. We try to use softwares that are user-friendly as possible, and a feature that's also important to us would be the offline methodology. It's because you don't always have the stable internet connection. So what do we want to do with this rapid response mobile labs? What can we do? So I call it the IDs that we can detect. So hosts, vectors, pathogens, outbreaks in a lot broader way, and then the so-called pandemic ID, right? So vector IDs, there's of course tons of arthropod species that can transmit many nice and nasty diseases. And for us, interesting would be ticks and mosquitoes. We've done mosquito sequencing as well within the Suitcase lab in different settings. We use this, rapid purification nucleic acid extraction, which is based on beads that attach the inhibitors and not the DNA. So you have less stuff that you need to do for the DNA extraction. So you have a, let's say, quick and dirty extraction, which is enough for your analysis. You do the sequencing, mainly with the rapid barcoding kits. It's unbiased, so no amplification. So you kind of, you sequence whatever you have in your samples, and then you look at the data. So we've used it to determine mosquito species with a customized offline database that can be updated and adapted to whatever you're looking at. So this is work in progress. And this is, of course, a relatively, fast workflow. Then coupled to vectors are, of course, hosts. There's many different hosts that like to get bitten by mosquitoes and ticks. And therefore, from an epidemiological standpoint, it's also important and interesting to us to see what kind of blood might be in this mosquito. And we've managed to find some alignments to different host DNA, so this is also quite promising. Of course, we want to have as much samples as possible to keep validating this. Then pathogens, of course, the reason why we're doing this as well. Focusing on vector-borne diseases, we've done some Aedes or mosquito sequencing, and we've also found some dengue hits. So this is quite interesting to us. Of course, it's not an amplification, so you will not find tons of hits, but you can find it, and you can have a first hint at what might these mosquitoes be transmitting. So this is, looking forward to more samples as well. Then, of course, symptomatic approaches. So if you have a diarrheal patient and you already have done some culture and some reference detection, and you're not sure if this is, this is what you're getting, you can do sequencing in the field as well, and try to get as much information as possible on the putative pathogen of the outbreak. And then, flu-like symptoms, especially since COVID, everybody's aware, and they're pretty unspecific. They can be pretty unspecific, and there's a variety of nasty pathogens that are all interesting to us that might be causing these symptoms. And so, in one of the studies we did in Nigeria a while back, we were having patients that had these symptoms, but we didn't know what was the causative agent. We didn't have any other, let's say, diagnostics on the site. So we used the Suitcase lab. We did some sequencing and we found Zika. So this is interesting. You can maybe even find co-infections. So there's once you have the data, you can play with it, which is a nice thing. And then the pandemic ID, let's say, so we can bring everything together. Here you can see the workflow, so from sample reception to sample analysis. We've used this in different simulation exercises with the WHO. So you have full PPE sample reception, not knowing what the sample might be containing. You have the glove box used for sample inactivation, and then in the middle, you can do some other molecular diagnostics. You can do isothermal amplification. You can prepare your sample as well, and then do the actual sequencing. And here, for example, we had inactivated influenza A spiked into the sample. So we found it. That was good for us. So taken together, the technology implemented in the Rapid Response Mobile Lab allows us to ID all of these things. And by doing so, we address the 4Ds, so we can detect pathogens at the point of need, so not taking the sample away from its origin, but keeping it as close as possible, saving quite a lot of time. This can then be used for, supporting decision makers. You can deliver sequencing technologies into a variety of healthcare settings, which, our sequencing technologies are here to stay. So we want to be using them as much as possible. And durability and robustness is a big issue and big thing to take care of in the field. So you need diagnostic setups that are as robust as possible for these diverse environmental conditions. So, taken together, ONT can support pandemic preparedness, and we're looking forward to, to increasing and improving these protocols and to having new collaborations. So with this, I thank you all for your attention. I thank all of our international partners from the Mobile Suitcase Lab Consortium. And special thanks to Dr. Ahmed Abdelwahed, which is our lab head, which is the mastermind behind the consortium. Many thanks.